Good afternoon, everyone. So, welcome to our live session webinar organized by KPJ Kluang Specialist Hospital. I am Dr. Kelly, a medical officer from KPJ Kluang Hospital, and I will be your moderator for today. Today's topic is lazy child or hidden problems. Just a little introduction about today's topic. Sometimes children who struggle with reading, writing, or speaking, they may be labeled as lazy or not trying hard enough. However, in reality, there may be underlying language or speech disorder or dyslexia. So today we will be talking about this topic, and we have our expert here, a pediatrician and a speech therapist who will be joining us. So before we begin, I would like to remind the audience, if you have any questions throughout our session, please feel free to type under our comment, and we will answer all the questions as much as possible during our Q&A session. So before we begin, it is my pleasure to introduce our speaker today, Dr. Tan Penji, our dedicated pediatrician from KPJ Kluang Specialist Hospital, and also joining us, Miss Tan Woon Jing, a speech therapist from Elite Speech Therapy Center from Kluang. So welcome Dr. Tan and welcome Miss Tan. Okay, so now let us begin with inviting Dr. Tan to share with us about child development and dyslexia. So thank you, Dr. Tan.
Okay. Okay, so basically today we will be talking about dyslexia, and if let's say there is any extra time, then we will touch a bit about speech delay, because I guess that for our audience, speech development is something that we are more familiar to compared to dyslexia. So I think because of the time constraint, we would like to put the focus more on dyslexia instead of something that we have already known like for the past few years. So dyslexia basically currently is considered as still quite the awareness is still quite low compared to other special need conditions such as autism and also ADHD. So these children usually being labeled as difficult students, lazy students, or those who are naughty in class. So is it really true that there are this kind of bad boys, bad girls, or bad students in school? So I guess today we will have a better insight about it. Then maybe we can try to wash their name through the proper knowledge that we equip today. So this is the slide that we prepared. So let's go through it together. So next, please. Okay, so before we start to talk about dyslexia, maybe we should come to know with some definitions that we as a medical practitioner usually not so familiar with, which is first one is the graphemes. So what is grapheme? It's actually the smallest unit in a writing system that represents a phoneme in a language such as B or SY. SY, it especially is being used in Bahasa Melayu. So macam Syabas, okay, SY. So it comes in as graphemes. So B is B. So that is one alphabet, or this combination of SY can produce a sound, and that is the smallest unit in the writing system. So as for phonemes, is a smallest sound unit in a system of a language, such as B, the B in bola. So during our time, last time, maybe like 2 or 3 decades ago, when we learn how to recognize the alphabets, we start with A, B, C, D, E, F, G. So nowadays there are a lot of kindergarten, preschool, they start to teach the alphabets in terms of phonemes instead of the name of the alphabet. So such as A, they don't teach as A, they teach as A, then B, S, D, or something like that. So instead of A, B, C, D, E. So it's quite interesting that because our generation, we don't really equip with this kind of knowledge, and we find it very weird for our children to learn in this way. One of my ward nurse actually came to me with a one day showing very concerned face, saying that she suspect that her child is having some learning difficulty. Now I was like, why what make you think so? Then she said, because my children don't read the alphabet in terms of ABC. He read in like B for bola, the B for he pronounced he named B as B. And I was like, no, that is a totally appropriate thing, or the mainstream of kindergarten out there is teaching our children how to recognize the alphabet, because this way of recognizing the alphabet can actually helps them to decode the word easier later in life. So we will talk about what is decoding later on. So now we need to know these two words, okay? These two terms, graphemes and also phonemes. Grapheme is the smallest unit in a writing system, whereas phoneme is the smallest sound unit in a sound system. Okay, next please. So what is reading? Okay, so reading is actually a process to understand the meaning of a written text. Okay, so we see a word, then we can understand what is written and what is the meaning behind the word, behind this sentence or behind the word. So before information is transferred in a written form, so like zaman kuno, like Paleolithic zaman, like that. So human communicate with sound or spoken language. So this required language comprehension. What does it mean by language comprehension? Meaning that we hear the thing, and then we listen the thing, and then we understand what does that language or what does that sound mean to us. So in order to have this language comprehension, it depends a lot on the reader's listening power and also the number of words that have been stored in memory. So take an example. A person with poor hearing, okay, they cannot hear clearly, so that will affect whenever we speak to them, then they will be like ha ha ha, or they cannot really listen clearly, or they cannot receive the information that we're trying to deliver to them adequately. So that actually impact their language comprehension. Or let's say us as a medical practitioner, we explain condition to our parent or to our patient in jargons. Okay, we tell them a lot of medical terms. Then like let's say you are having some pneumonia, so we need to start you on nebulizer and we need to start you on cloxacillin, blah 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 blah. So the patient who is a layman, they don't understand all this jargon. So again, the information that we are trying to deliver to them is impaired by these words, the number of words that they understand. So this also will affect their language comprehension. So again, language comprehension comes in two very important factors, which is number one, the hearing power, and number two is the number of words that the listener may understand or memorize. So when information comes in written form, the meaning and message is encoded in the letters and printed text. So meaning that when come to reading, in order to understand what these words or what the sentence is trying to express, this require another extra step, which is decoding the words. So because you need to read the letter, and then so that you can produce the sound, and from when you produce the sound, then the listening comprehension, the language comprehension will come in. Because when you read it out, then you will listen the sound, and then only you will understand what does that sound mean. So reading is actually an extra step of decoding the letters, and then so that we can understand the words that was written there. Okay, next. Next, please. Okay, so reading ability is the combination of decoding component plus the listening comprehension component. So decoding is the ability to correctly decode the written words. Okay, so listening comprehension is the ability to extract and construct meaning after listening the information in the form of spoken language. So it basically is the summary of what I have been saying just now lah. Oh, next please. Okay, so now we can talk about dyslexia. Okay, so what is dyslexia? According to International Dyslexia Association, it's actually a specific learning disability characterized by difficulties in word reading and or spelling that involve accuracy, speed, or both, and vary depending on the orthography. So it is not necessary that the patient can read, but that patient the child can read, only then is considered as not dyslexia. Okay, as long as they can read but it's very slower than they expected to be, then it's already considered as dyslexic. Or if they can read very fast but it's not accurate, that is also considered as already dyslexic according to International Dyslexia Association. But what we see is actually the DSM-5. Can we move on to the next slide? So according to DSM-5, there are 4 categories that can define this, four points that can define dyslexia. Number 1 is difficulty learning and using academic skill as indicated by the presence of at least one of the following symptoms that has persisted for at least 6 months despite provision of intervention that target those difficulties. So meaning that, okay, next slide first. So what are the six points? Is number 1, inaccurate or slow and effortful word reading. Okay. Number 2 is difficulty understanding the meaning of what is read. Okay. Number 3, difficulty in spelling. And number 4, difficulty with written expression. And number 5, difficulties mastering number sense, number facts or calculation. And number 6 is the difficulty with mathematical reasoning. So this 6 point is either one of it, as long as this child exhibit any one of these criteria with targeted guidance and is still not corrected, then it's already fulfilled the diagnosis of dyslexia. You can see that number 5 and number 6 actually involving mathematical ability, which is something that common in terms of dyslexia as well. So dyslexia, of course, when you look at the definition, dyslexia, there are a few special learning disability. So one is dyslexia, one is dysgraphia, and one is dyscalculia. So this all actually falls in this DSM-5 definition of special learning disability. Okay, number 6. Next. So B is the affected academic skills are substantially and quantifiably below those expected for the individual's chronological age and cause significant interference with academic or occupational performance. So meaning that if, like, let's say a child who is standard 5, okay, but then his performance is up to standard 1 or standard 2 only, and is not correctable through targeted guidance, then that also considered as at risk of having dyslexia. Okay, next. So the learning difficulties begin during school age years but may not be fully manifest until the demands of those affected academic skill exceed the individual's limited capacities. So this is a very interesting point, because a lot of patients with dyslexia will present to us not at like kindergarten level or preschool level. They come to us at the age of standard 3, standard 4, or even standard 5 or something like that. So why is it so? We will talk about it later on. Okay, next. So the last one is the learning difficulties are not better accounted for by intellectual disabilities, uncorrected visual or auditory acuity, or other mental or neurological disorders. So meaning that in order to label a patient with special learning disability such as dyslexia, dyscalculia, or dysgraphia, you need to make sure that this child's IQ is intact. So meaning that we cannot say that because he is having some syndrome, okay, like let's say Down syndrome, okay, or Turner syndrome or some other syndrome, or because of they have very poor eyesight, or they are deaf or something like that, and affect their ability to learn properly, and hence we label them as dyslexia. No. So we need to exclude all this possibility before we can really label this child as a dyslexic child, and then proceed with appropriate dyslexic management. So we will talk about the diagnosis later on, and we will be more clear about it. Okay, next. Okay, so dyslexia actually comes with different severity as well as usual. So it comes with mild, moderate, and severe. So for mild form, they actually have some difficulty learning skills in 1 or 2 academic domains, but of mild enough severity that the individual may be able to compensate or function well when provided with appropriate accommodation. So the keyword here is actually able to compensate, meaning that if this child having some dyslexia or something like that, then with appropriate guidance, teaching, and they can correct it and they can do whatever they should be done well, then that is considered as mild. Okay, so for moderate, next. For moderate, one is one or more academic domains is unlikely to be proficient without some intervals or intensive and specialized teaching. So in terms of moderate, even they will require, they can still function well, but then they will require a bit more intensive guidance or more specialized teaching. Then they only can correct from that. Then that is considered as moderate. So when we talk about severe, next, severe is that when may not be able to complete all activities efficiency even with array of appropriate accommodation or services at home. So meaning that even with some help, even with some aid or something like that, they are still struggle with to complete their schoolwork or even in their workplace the task that they should be doing. So that will be considered as a severe dyslexic or severe special learning disorder. All right, next. Okay, so talking about the prevalence, so how common is it in Malaysia? So according to International Dyslexia Association, this is one of the commonest learning disability, with the prevalence ranging from 5 to 17.5% among school-age children. This data is worldwide data. So in Malaysia, there's approximately 314,000 students who suffer from dyslexia, but I believe that this number is way below from the reality because of underreported or underdiagnosed. So according to America's study, basically one in every 10 students have this problem of dyslexia in their class, so which fits into the 5 to 17.5% prevalence. So it's very common. Also now, if you recall your school time, maybe you can remember some of your classmates always struggle in their schoolwork no matter how hard they try. Okay, so that might be the cause or the problem they are struggling with. They are not stupid, they are not lazy, but maybe they are having some dyslexia there. Okay, so next. Okay, so the signs and symptoms, we will talk about this later in the pictorial form. Okay, our time is running out. Next, please. Okay, so so small. Okay, so I'm not sure that if you can see the picture well or not, but basically they have this the common signs and symptoms of dyslexia is they have trouble with letter reversal such as B and D, M and N, V and U, Q and P. Okay, or they have the whole word reversal such as was and saw. Okay, they will confuse these two. Okay, because they cannot really recognize the alphabets. So they will have troubles reading aloud, or they have troubles with word problem in maths. Okay, or have trouble learning how to read. The process is slow, labor, and it's not much fun. Okay, then have trouble understanding the jokes, punchline, sarcasm, and also interference, or have trouble with spelling. Okay. Okay, next. Or sometimes they even have problem with differentiating left and right, okay, front and back, or something up and down. Or they are unable to put on their shoes properly. Okay, so this is a handwriting of a dyslexic child. So you can see that the words are, first of all, the words is very, the alphabets are terbalik one. Okay, you see there was, okay, there were, okay, so the E is terbalik, okay, and the S is terbalik, the house, okay, S is terbalik. Another thing that you can realize is the spacing, okay. The spacing is very poor. Okay, supposedly for a children who gone through at least 2 years of kindergarten education and 1 year of primary school education, they should be able to space their words properly. So when you see that there are poor spacing in between words, that is an early sign of this dyslexia actually. So you might have to watch out. Next. So this is another example. So you can see that the handwriting is very messy, okay, and you basically cannot understand you can see that the number 4, the whale shark, okay, they cannot understand, they cannot really copy properly, okay. And next one. This again is a very messy handwriting, okay, and there is very poor spacing. Suppose they have to copy down the sentence below, but then what happened is turn out up there also is a very typical dyslexic handwriting. Next. Okay, so the etiology could be multifactorial, okay, and it's definitely familiar, okay, meaning that this dyslexia might run in family. So sometimes when we talk about history taking, you can we might have to ask the parents' educational level. So a lot of them will tell you that they might stop going school very early, saying that they have their family is a bit difficult lah, they need to come out to work lah, this and that. So but sometimes we need to dig further, saying that whether is it because of the reading ability, the study ability, or because of really the social economic status. Another one is a gene environmental interplay. So meaning that the environment, the situation, the family, how they were brought up also actually affect the outcome of this dyslexia as well. Okay, next. Okay, so brain basis of dyslexia, this is a bit complicated, but we just go very, very fast. So you can see that the brain, there are two brains there, left and right. Okay, so the left one is the typical brain and the right one is the dyslexic brain. So typical brain, when we do reading, the affected area is actually three areas. One is Broca areas, another one is at the parietal temporal region, which is more of this phonological processing and phoneme grapheme conversion. And then next one, the other area that was affected is actually the occipitotemporal region, which works for the visual word area and to recognize the whole word as a whole. So in dyslexic patient, they have these two regions underactivated. So meaning that they cannot process the word as a whole, and they have difficulty in converting the grapheme into phonemes and then to decode the word further. Okay, next. Okay, so diagnosis, there are a few tools that we can use to diagnose whether a child is having dyslexia or not. So one of the tools that I personally use is this MyBaca OG. This MyBaca OG is a tool that developed by local USM OT team, especially for Malaysian children. So this currently only have a Bahasa Melayu version. So the reason why they use Bahasa Melayu compared to English is actually because Bahasa Melayu is more consistent in phonemes. Like A in Bahasa Melayu is always A. In I, Bahasa Melayu is always E. It's unlike English where A it could pronounce as cat or A or can pronounce. There are a lot of different pronunciations. So comparatively, Bahasa Melayu is more consistent. So they actually use Bahasa Melayu as the basic first. Then later on, only they develop. They come out with a Bahasa English version. So this is for children 8 years old and above, because again we require the child to have at least a basic training in the language before we can assess them. Okay, next. So we will test them on, you can see there are two pictures. So first we will test them with simple and common words like ager, tua, esok. Why? Because the dyslexic child, they can usually hafal, they can usually memorize the word by force and recognize many words in the beginning. So like that's why we will test them with very simple words first. Then after that, we will try to test them on the right picture, the Arnold gimbal, which is what we call as nonsense words, meaning that they will never see this kind of word before. So in this kind of condition, they will have problem in reading out all these words instead of like memorizing the common words that they usually see. Next. So after that, we will test them on phonemes, on the language comprehension, by asking them that, like, let's say gembira. Okay, after we take out B, what is the word or what are the sounds that was left? Like they have to tell us is gem and r. But in patient with dyslexia, they might have some problem with that. And then next, we will test them on reading the alphabet fast. Okay, A K O S P S O P K A. So that because in children with dyslexia, these are the common words that they have difficulty in recognizing. So if they can read but very slow, that also meaning that they might have this dyslexic problem. Okay, next. So this is as actual patient of mine. So the last part of the examination will need them to do spelling. So you can see that the number 5 is Maja. Okay, they spell with Maja, but the word that they need to spell is actually major. So they have problem with spelling in the proper. This is an 11-year-old child, by the way. So 11-year-old child supposed able to spell simple words like major, dapat, but instead of dapat, you can see that he pronounced D with T and P with B. So meaning that he has problem to differentiate these two words, or to have problem with the phonemes recognition. Okay, next. So the dyslexia iceberg usually have this what we can see is decoding words problem, word reading problem, vocab problem, spelling problem, fluency problem. But the real impact is actually what we cannot see, which is behavior problem, social relationship problem, anxiety, stress, frustration. So what are the symptoms that, or what are the reason that my patient usually being referred to me is actually not because of learning disability or because of poor academic performance, but because of hyperactivity or poor focus. So a lot of children actually referred by their teacher saying that, or they have poor focus, cannot remain seated in class, or they always catch out other people or something like that. But the reason is because they cannot understand what the teacher is talking or what the teacher is explaining at all. And when come to doing homework, they have this problem with completing their homework, or they cannot stay focused because they cannot really understand what is written on the book or what they should be really writing. So the reason why the children is being referred to us at the age of standard 2, standard 3, or even standard 4 is because during early school years, kindergarten, standard 1, standard 2, they can read by forced memory. But as time goes, then we can really see that they have to read longer passages, they have to write essays, and these are the time where the problem really arises. So that is the main reason why the children with dyslexia are usually detected much later than it's supposed to. Okay, next. So the treatment is basically by appropriate training in terms of for reading training. So supposedly they should be going through this KBID. So there are two ways. One is they go to this KBID to train how to recognize the alphabets, how to read full day, which means that they come out from their school and go to this program for 2 to 3 months. After 2 to 3 months, they will be assessed. If let's say they can read properly up to their age, then they will go back to their normal school. Another way is go for Saturday classes, same thing as well. After a period of time of training, then they can go back to their school. The important thing is that IQ in dyslexia children is totally normal, which means that they shouldn't affect their ability to learn as long as they are able to read. So when this problem is being corrected, they usually be able to pick up in their academic performance very fast. But the problem is how old were they when the problem is being detected, and how compliant are they to the treatment. Okay, next. So in Kluang, we used to have this dyslexia program in SK Kluang Barat, but unfortunately today I just received the information from their penyelaras untuk PPKI, which is the special education class. They have already cancelled this program, dyslexia program in their school because of not enough students. So they have pendidikan khas right now, but then they mainly focus on autism and also ADHD. So maybe what we can do from our side is actually to detect more of these children with dyslexia, so that we can increase the data in the PPD, so that they can restart this dyslexia program, so that more patients or more children with dyslexia can get the benefit from it. Okay, next. Okay, so these are the famous people with dyslexia, and dyslexia definitely can do very well. Okay, so next. Okay, so these are my references. I think we don't have time for the speech development lah. Also, I guess if there's any problem, then maybe we can leave it in the question. We can leave it at the Q&A part. All right. Okay, thank you.
Okay. So thank you, Dr. Tan. Thank you for the informative sharing from Dr. Tan. Now, next, we would like to invite Miss Tan for her sharing on her expertise and perhaps some of the real life cases for discussion. Please, Miss Tan.
All right. Good afternoon, everyone. I'm Won Jing, speech language therapist from Elite Speech Therapists. So moving on to the slides. So before we talk about the speech and language problem, let's first look at some of the common concern the parents share to me. So when we see in a child or a clinic, we usually see the behavior first. So we see the child throw tantrum, didn't sit properly, or crying during the reading task. So very often the conclusion is that the child is lazy, stubborn, or having a bad attitude. However, next slide, please. Okay, however, this behavior may not be the real problem. There may be some of the sign that an underlying difficulty that the child cannot explain. Next. Okay, so the parents complain that their child is ignoring the instructions, so they assume that the child is not listening in the class, so the child is walking around in the class. So, but you imagine that the instruction given is take the blue pencil, circle the biggest animals, and underline the word that start with P. And for a child with language comprehension difficulty, this is extremely demanding. So the child must understand the vocabulary such as circle, underline, biggest, and hold multiple steps in working memory, and the process phonological information. So in this case, we might suspect that the child having a poor working memory and a poor language comprehension. So by the time the child picking up the pencil, they already forgotten what is the instruction is. Okay, so what look like non-compliance may actually be the connecting overload. Next one. Okay, you might also heard that the parents report the child refuse to read aloud in a class or avoid homework at home. So the adult may also think that the child is lazy. However, we might suspect that the child is having a weak phonological awareness or difficulty in decoding. So reading is, of course, becomes slow and effortful for them. So every reading words require a conscious effort. So imagine being asked to read a foreign language in front of others. So the embarrassment and then the anxiety would be overwhelming. So avoidance then become a protective response for them. Next one. So another example is some of the parents also said that the child always throw tantrum during the task. So we might also consider the child having a sensory overload or motor planning difficulties. So for a child with a speech motor planning issue, speaking itself require intense concentration. So if we repeatedly pressure the child, say again or try again, so the frustration builds. So then there become a stress response to throw a tantrum during the task. Okay, next one. Okay, we might also see a child that cannot sit still in a class, and it may not always be the reason of hyperactive. So sometimes it reflects a short attention span due to the processing difficulties. So if the brain is working extra hard to maintain the memory or plan the response, maintain the attention in a class, so the fatigue set it quickly. So the movement is for the child for self-regulation, that the overload of the work. Okay, therefore, instead of asking why the child is behave like this, we should ask the child, ask ourselves what is making this task so difficult for the child. So when we shift from judging the child behavior to understand the underlying processing difficulty, then we will see the reason behind. Okay, next one. Okay, before going to the diagnosis in common diagnosis in our speech therapists, I would like to start with how the reading actually works. So I will share a theory, a simple view of reading. So this theory explains the reading comprehension as a product of a printed word recognition and a language comprehension. So reading comprehension occur only when both of these two components function effectively. A weakness in either one will limit the overall comprehensions. This means that reading is not just seeing the letters, but also it depends heavily on the language skill. So when a child has a speech or language difficulty, these foundations are affected and the reading become harder for them. So I would like to share about some of the sign and symptoms of dyslexia, also overlap with the common symptom with common diagnosis in speech therapies. So this may lead to misdiagnose. Okay, next one. So here is just a simple question for all of you. So are speech and language are the same? You can type in the chat box. One is yes and two is no. Okay, I believe that all of the answer is correct. The answer is no. The speech and language is totally a different context. So speech is how we say the sound and words using our mouth and the voice. So it is about how clearly and smoothly we talk. But language is how we understand and use the word to share the meaning and to communicate. So it includes the vocabulary, grammar, and forming the sentences. So it is about understanding and expressing. Next one. So here comes the common diagnosis in speech therapy. So the first one is a developmental language disorder, also called DLD, and speech sound disorder, SSD, childhood apraxia of speech, also known as CAS, and language disorder with others, neurological disorder. Next one. So let's moving on to the first diagnosis first. It's a developmental language disorder. So it is a disorder primarily disability without a known medical cause and persisting at a school age and beyond. So normally we will diagnose the child with DLD after the age of 5 when the language difficulty are persistent and not explained by other medical diagnoses such as autism, ADHD, or hearing impairment. So the children who have not yet had other medical diagnoses or still under the process of assessment still are considered in the diagnosis of DLD. So this kind of children will have the difficulty learning to read and write. A learning disability is then identified when DLD negatively affect a child's academic performance. So depending on the research study, so nearly half of the children with early cognitive problem develop a further academic difficulty when they transition from
technical issue，可以小便吗？
快点去
拿根筋，
那个 toilet。
拿根筋，根筋。啊，我那个。
哎，小心小心。
啊？好了。
劲啊，你们。那英的问题是啥？
那我从哪里开始嘞？
就从你听那边到，他有点 confused。嗯，
question 啊有 question 吗？没有。
什么
有？question？还不知道。
因为我不懂要怎么样
对
去看那个 chat box 嘞，我怕我是要 register 才可以按进去。看起来是没有啦。嗯，好了吗？哦。 Welcome back. We are truly sorry for the interruption just now due to some technical issue. So now we will resume back with Miss Tan's presentation. So Miss Tan, thank you.
All right. Okay, I'll just continue back to our the first okay. Okay, like I said just now, some of the symptoms for dyslexia and DLD is actually overlapped. So both DLD and dyslexia involve a phonological deficit. So the key difference is the broader language skill. For DLD is a weak phonological skill, vocabulary, grammar, and sentence comprehensions. So they show difficulties in both phonological and non-phonological language domain. But for dyslexia is having a weak phonological skill, but the vocabulary and grammar usually is relatively intact, and the main difficulty is word level reading and spellings. So this come into a small conclusion. Most of the children with DLD are at risk for dyslexia, but not all the children with dyslexia have DLD. Next slide. So these are some of the signs and symptoms for developmental language disorder. So the child usually will show weakness in language and phonological. So they show limited vocabulary, difficulty in telling story, difficulty pay attention in class, or don't remember what the teacher had just says. So this is all the foundation skill needed for learning to read. Next one. So according to the theory I introduced just now, the reading comprehension depending on two main ability, the accurate word reading and the language comprehensions. So children with DLD already have the weakness in language comprehensions. So they are at higher risk for reading difficulties. Many children with DLD also have a poor phonological awareness, so they are struggle breaking words into sound or remembering the sound sequences. So research conducted shows that the phonological processing deficit are the major pathway to dyslexia. So when these children start school, they may find the phonics difficult and reading becomes slow and inaccurate, and the spelling is inconsistent. So at this stage, they might be identified as having dyslexia, but the root problem actually started earlier in language developments. So again, it is important to remember that not all the children with DLD have developed dyslexia, but they are at significant higher risk. Next one. So next one is our second common diagnosis is a childhood apraxia of speech, also known as CAS. So it is a motor planning disorder for speech. So children with CAS know exactly what they want to say, and in most cases their receptive are usually intact, meaning that the child can understand the language normally. So the difficulty lies in the brain ability to plan and coordinate the precise movement to produce the speech sounds. So as the result, their sound is often inconsistent and effortful. So this increases the risk for problem in expressive language and weaknesses in the phonological foundation for literacy. And the research indicate that 50 to 70% of the children with CAS struggle with readings. So some of the population also will think that apraxia only affect the physical or the limb movements. So however, the difficulty is in the motor planning for speech. We also see a significant number of CAS in our caseload. Next one. So when we look at the sign and symptom for CAS according to ASHA, the first one is the inconsistent error or the consonant vowel. So this means that if I ask the child to say the word put, the first time they will say the word put, but the second time they will just say ho. So this inconsistency is a hallmark features for CAS and reflect the difficulty in motor planning and just not the simple speech sound delay. The second one is the lengthened and disrupted transition between the sounds and syllables. So children with CAS often have difficulty smoothly move from one sound or the syllables to another. So for example, if I ask the child to say banana, the child will just say nanana. Okay. In addition, the inappropriate prosody also will show in a child with CAS. So this refers to abnormal stress or intonation patterns. So this cause their speech sound unnatural and further reduce their speech intelligibility. Next one is a CAS also called occur with a non-speech sensory and motor difficulty. So some children will demonstrate a growth or fine motor delay. So this will let them to have a difficulty in writing. So other may also present the lip apraxia, meaning that they have difficulty planning and execute a purposeful movement with their arm or hands. So overall, these signs help us to differentiate the CAS from other speech sound disorder and guide an appropriate intervention planning for them. Next one. So because of their speech sound production is inconsistent, their phonological presentation, the mental storage of the sound is also weak. So this directly affect the phonological processing, which is a foundation for the phonics and decodings. So when the phonological awareness is weak, the reading becomes slow and inaccurate. So these children may have struggled to blend the sound or segment the words or recognize the sound patterns. So this increasing their risk for reading difficulty that can resemble dyslexia. Okay, next one is I mentioned previous one. Okay, next one is the motor planning difficulty. As I mentioned before, the fine motor skill will also be affected, so their handwriting skill will also show inconsistent, so that maybe have a poor letter formations. In terms of communication, speech is often difficult to understand, inconsistent, and require significant efforts. So because the speaking is hard for them, the children may avoid to talking or avoid to participate in the class discussions. So together, CAS impact the reading, writing, and social communications. So even though the language comprehension is generally intact, so these children may appear dyslexic because of their literacy difficulty, but the underlying issue is the motor planning difficulties. Next one. So before moving on to the next, our common diagnosis in a speech therapy, I'll have a simple question here. Do you think unclear speech is because of tongue tie? Put in the chat box. 1 is yes and 2 is no. Oh, unclear. Oh, I heard the answer is unclear speech is because of the tongue tie is a yes, but the answer is actually no. So for parents may concern the child have a tongue tie, the tongue length is not long enough for them to produce a clear speech. But majority the case we receive the speech sound disorder is not because of tongue tie. So speech sound unclear speech is can be motor planning issue or coordinate the mouth movement, hearing problem, or language delay or disorder. Okay, so it's not because of tongue tie. Okay, next one. So another question is the child cannot speak or cannot produce the clear speech is because of number 1 must be the oral motor issue, or number 2 may be others issue. Just put in the chat box number 1 and number 2. Number 1 wins, so the child cannot speak because, okay, the answer is number 2. So some of the population will think that oral motor exercise can resolve all the problem for unclear speech, but our job is not that straightforward. So oral motor exercise are not the main field in our job scopes for pediatric language skill. This can be due to the sound learning system or the hearing problem or the motor issue. So it's not just motor difficulties. Okay, next one. So here comes the other diagnosis, a speech sound disorder. So it is referred to a condition where a child has a frequent difficulty producing speech sound or hard to understand when speaking. So there are two types of SSD. So the first type is articulation disorder, so meaning that they have trouble forming specific sound correctly. For example, I ask the child to say sun, they might say tan. So you may notice that the child drop or add some sound into a words. So the second type is the phonological processing disorder. So in this case, the child show difficulty understand and apply the sound system of their language. So which lead to a predictable pattern of errors. So for example, the child consistently replace the K sound to a T sound. So for example, I ask them to say cat, they will say tat tat tat. And all the sound with a K, they will replace to the T sound. Next one. So here are some of the signs and symptoms for the children who have a speech sound disorder. So the first one is deletion. For example, for book, they will pronounce a book. For substitution, they will replace the sound with different one. So I ask them to produce rabbit, they will just produce rabbit. Or addition, they will add an extra sound into a word. Dog, they will produce dogu. And distortion and interdental s sound will produce with a tongue between the teeth, sound. Okay, next one. So moving on is a study conducted indicate that with isolated speech sound disorder show mild difficulty in early phoneme awareness and the spelling during the preschool years. However, the impact on later literacy is small and mostly short-term. So by the age around 8 years old, the effect significantly reduced and most of the children will recover. So the child with isolated as a speech sound disorder will carry a low risk for a long-term reading problems. However, for the child who have a speech sound disorder plus a language impairment show significant literacy difficulties. So the difficulty is even more severe when there is also a family history for dyslexia. So and among these factors, early language impairments is the strongest predictor for later literacy problem, especially the reading comprehensions. So if the SSD perceived into school entry when formal reading instruction come in, it can be negatively affect their phonological awareness and also early reading skill. Next one. Okay, just want to ask you about this question. Are you familiar with any diagnosis that I mentioned just now? The number one is DLD, developmental language disorder. Number two is childhood apraxia of speech. Number three is speech sound disorder. Number four is language disorder, but with neurological disorders such as SD, ADHD, or hearing impairments. Number five is, sorry, I didn't hear or familiar with any diagnosis I introduced just now. Number one, okay. I heard that the developmental language disorder is most people familiar with the diagnosis. Okay, all right, take note. Okay, moving on to the case discussion. Okay, so after introduce so many common diagnoses in speech therapy, let's go for a case study. So number one is a 4-year-old child. The initial concern is limited speech, frustration in communication tasks. The parents' complaint is that attempt to produce the words but struggle to speak. The teacher complaint is that the child always have the difficulty in imitating the early vocabulary. So after the assessment, the pre-verbal skills such as the eye contact, joint attention, imitation is established. The receptive language skill is intact, and the expressive language skill is 1 year old 6 months. So the current communication method for this 4-year-old child is a single word level with gesture. So the assessment finding is difficulty combining sounds, inconsistent sound errors, and reduce the prosody, and also show verbal distorting speech. So I would like to ask our audience can guess what is the diagnosis is. Next one. Yeah, you can type number 1, number 2, or number 3, and number 4, or number 5. Sorry, I don't know. Number okay, moving on to the next slide. Okay, so the diagnosis is actually the moderate to severe childhood apraxia of speech. So for our management, we will focus on the motor speech therapy that help the child to learn correct speech movement patterns. So we also use some visual and tactile technique to prompt and improve the consistency of the speech sound and prosodies. So because some of the children may have a high communication demand, we also will implement augmentative and argumentative communications to reduce the frustrations. Next one. Moving on to case study number 2. So it is a children with 6 years old. The initial concern is show difficulty to produce longer sentences, poor storytelling skill, show grammatical error, difficulty follow longer command. The receptive and expressive language skill got to be at the level of 4 years old, but the child already 6 years old. So current communication method is verbal, but mostly 3 to 4 words per sentence. So the audience maybe can guess the diagnosis. Next one. Okay, it's the same. Number 1, number 2, number 3, number 4, number 5. Number 4. Number 4 is language disorder, or number 4 with language disorder, but the answer is, let me see. It's a moderate. Next one. The answer is a moderate developmental language disorder, but good try for the audience. So the management usually will focus on improving vocabulary, the grammar, and the sentence length through a structured language therapy. So the narrative or the comprehension skill are also will train, maybe using a visual prompt for them. So the pragmatic skill are also will be targeted on to improve in a classroom performance since the child already 6 years old. Okay, next one. Case study number 3. So it's a 4 years old child. The initial concern is limited work production, show difficulties following instructions. Parents complain that prefer to play alone, and limited conversation turn taking, and the child is on ASD spectrums. So the pre-verbal skill, the joint attention, and the eye contact is emerging. The imitation skill is the child able to imitate single words. So after the assessment, the receptive and expressive language skill is level of 1 years old 6 months for a 4 years old child, and the pragmatic skill is 1 year old 4 months. So the current communication methods is a limited verbal expression with gesture. So next one. So the audience maybe can guess again what is the diagnosis. 1, 2, 3, 4, 5. Yeah, the answer is language disorder. Secondary to the neurological disorder here, it's autism spectrum disorder, so it's ASD. So correct. So the management will be focused on similar with DLD, the vocabulary, grammar, and the sentence length. So since the child already 4 years, so the pragmatic skill, the social skill will also be targeted to improve in classroom performance. Next one. Yes, the answer is moderate to severe language disorder, secondary to ASD. Next one. Okay, that's all from me. Thank you for your attention.
Okay, thank you, Miss Tan. Thank you for the very interesting and interactive session from Miss Tan. So now is our Q&A session turns. And for audience, if you have any question, you can still put down your questions under the comment or the chat box. Then we will ask the questions to Dr. Tan and Miss Tan. So now let's see what are the questions that we have here so far. Okay. So we have one question from Ben. And Ben asks, may I clarify at what age of a child is considered speech disorder when unable to speak a proper statement or unable to combine the word into sentence? I think Dr. Tan would like to answer the questions.
I think this question can be answered in two ways. One is that when we consider as a speech delay, when a child cannot combine two word sentences, is actually where we look at the development milestones. The general idea of to determine whether a child is having a developmental delay or not, be it from the motor skill, the fine motor, gross motor, speech or social, is if they have more than 6 month delay compared to the age that they're supposed to be achieved, it's already considered as delayed. So let's say, back to the question saying they're unable to combine two word sentences, this is a skill that's supposed to be attained at the age of 1.5 years old. So by definition, as long as they are not able to do so before the age of 2 years old, then we will consider as really delayed. So that is also the standard that KK is using for further referral to either speech therapist or to us pediatrician for further evaluation if, let's say, a children cannot speak, cannot combine two words, cannot build a two word sentences at the age of 2 years old. But when talking about unable to speak properly, if then maybe that will have to let Ms. Tan to answer.
Okay. I think the child who cannot. So the question is a speech disorder. So speech disorder, like I say, the language and speech is totally a different context. So, but the concern I think is more to the language disorder because they say that they cannot combine two words in a sentence. So I think, do they mention how old are the child is?
No. The question is whether at what age of a child is considered speech disorder.
Yeah, I think I will just like Dr. Tan mentioned just now, we will just see the milestone for a non-children, and then I will just compare after the assessment, then we'll giving a result for them.
Okay. So I hope the question is answered for Ben. So thank you for answering this question. There's also another question for Dr. Tan. In your expert opinion, Dr. Tan, when do you think when a parent thinks that their child is lazy or slow in learning, how often do you think is there actually an underlying development issue or learning issue?
This is a very difficult question to answer because a lot of times when we're talking about children being difficult or being naughty, right, it's not one isolated reason. There is a lot of condition that can give rise to this kind of feedback from the teacher or from the caretaker. The most common reason, number one, is not dyslexia but ADHD, hyperactivity. So when we talk about hyperactivity, they not necessarily present in the way that is a physical hyperactivity, but they can come with poor attention, inattention. So this actually will make them have very short attention span, and they tend to like unable to control themselves and moving here and there and tend to like disturb other people. So other than that, also comes with dyslexia, also come with mild ASD, and also some other like maybe depression and also anxiety disorder can also, or even sometimes the have difficulty with adaptation with the environment also will give rise to similar presentation as well. So looking the one of the most common misconception that I usually encounter in my clinical practice is that when we're talking about stress in children, a lot of parents or a lot of caretaker will actually come with the response that small children where will have stress. But we actually have a lot of children come with frequent headache, frequent abdominal pain, or frequent episodes of vomiting because of this kind of mental stress. So stress does exist, especially in children in society nowadays. You can imagine that your children every day wake up in 6 o'clock in the morning and then go to school until 12:30 or 1:30 p.m. Then go home for lunch, then continue with tuition until 6:30, and then continue with their talent class, piano class, drawing class until 9:30. You work also never work so long, right? So what more about young children who wake up and start working until start learning things whole day long. So this kind of mental and physical stress is real. So sometimes they tend to have adaptation issues or stress problem that can actually give rise them to all this kind of so-called behavioral problem. So but to really identify them having some underlying organic problem is very difficult to really give a figure. But my advice is actually to parents especially is actually to listen or talk more to your children, instead of just act as play the role of chauffeur, like drive them here and there and provide them with material things. I think giving them mental and psychological support is the main, because to be honest, the best person to identify whether the child is having problem or not is actually the caretaker, because supposedly your caretaker, the parents, is the one who spend most time with the children, so they really can tell what's wrong. But the problem is, do we have the time, or do we have the patience, or even do we have the skill to retain all this information that can tell us what's really going on with the children?
I think thank you, Dr. Tan, for answering this question very well. And also we have last one question here for Miss Tan. Miss Tan, in your opinion, what do you think is there so-called the right time for parents to seek help from speech therapists, or is there a right time for GP to refer a child they suspect with speech or language problem?
Okay, I think there is not a so-called right time for them to refer to a speech therapist. So when the parents and the GPs saw that the developmental already delay, so I think it is early referral to speech therapist is always better than waiting. So some of the parents will think that like 2 years old is always too early for them to assess for a speech therapist. But I think early referral can let us to identify what is the underlying issue for them to have a speech delay or disorder. So when GP say seeing the child who I mentioned just now ignoring the instruction, or cannot combine words, or difficulty to communicate with others, then I think it's not a right time. I think it's a best time or a early time to refer to us.
Okay. So I think here comes to the almost end of our session, and thank you very much once again to Dr. Tan and Miss Tan for the information and sharings and answering all the questions. So now finally, thank you everyone for your participations and for joining us today. We will have a QR code for GP to scan for registration of CBD point. So please take note of that. So once again, thank you. Here comes to the end of our session, and happy Chinese New Year. Selamat berbuka for our Muslim friend. Thank you for joining us. Thank you, Dr. Tan. Thank you, Miss Tan.
Thank you.
Have a pleasant evening.